Chapter 14, Department of Health and Human Services. Author, Roger Severino, Vice President of Domestic Policy at the Heritage Foundation. Director of the Office for Civil Rights at the U.S. Department of Health and Human Services. So 2017 to 2021. Chapter 14 is one of the central departments in the remaking of the government due to what Severino labels a crisis that threatens America's long-term survival. Precipitous drop in life expectancy, with white populations alone losing 7% of their expected lifespan in just 1 year. Severino proposes that HSB rename the Department of Life, and the new secretary should install a pro-life task force of political appointees to ensure that the mission furthers the health and well-being of all Americans from conception to natural death. To that end, Severino enumerates every area of the department's work where abortion can be removed from the mission. He also notes every area where faith-based programming can be promoted and outlines specific regulations that must be changed to accommodate religious exceptions. For example, allow adoption agencies to refuse to consider same-sex couples. Severino emphasizes the department's role in championing heteronormative marriage under what he calls the family agenda. The Secretary's anti-discrimination policy statements should never conflate sex with gender identity or sexual orientation. Rather, the Secretary should proudly state that men and women are biological realities that are crucial to the advancement of life sciences and medical care, and that married men and women are the ideal natural family structure. Gender-affirming care, like abortion, is labeled as harmful. The chapter also addresses programs such as Medicare, Medicaid, and the Affordable Care Act. Severino argues for competitive market-based revisions and a general policy of leaving individuals to make their own health care choices. For Medicaid, work requirements and eligibility would be reviewed. In the same spirit of freedom, he proposes restructuring the SEDC and NNI so that vaccine and mask mandates would no longer be part of public health policy. Commentary. Here, Severino presents a radical, politicized plan to transform the Department of Health and Human Services into a department ruled by Christian religious values. The opposite of religious freedom, since imposing those values affects everyone in the U.S., the plan also shreds the concept of public health, which relies on individuals agreeing to certain regulations for the benefit of the entire community. This chapter is complex, but has 4 main goals. First and foremost, enshrine anti-abortion policy in every single aspect of the department's purview. Weaken Medicare, Medicaid protections under the guise of consumer choice. Use a biblical definition of marriage and promote marriage wherever possible. Enshrine a binary definition of sex as the law of the land. Label non-binary gender and trans issues as harmful and unacceptable. Chapter 14, Key Points. Rename HS the Department of Life and center it around an anti-abortion agenda on abortion, fertility, marriage, family. Abortion is not health care. It harms women and girls. It harms women and girls. Ban mifepristone and outlaw mailing it. Ban the morning after pill. Remove all funding from Planned Parenthood. Prevent Medicaid from paying for abortions. Prevent Medicaid from paying for abortions. Promote the rhythm method for contraception, fertility awareness-based methods. Ban fertility treatments such as 3-person embryo creation. Marriage and family should be defined by the Bible on sex gender. Sex is binary. Any challenge to this is junk science. Gender-affirming care causes irreversible physical and mental harm on insurance. Turn Medicare into a free market program. Make people pay for some care under Medicaid. Put lifetime caps on Medicaid benefit.